So, hello doctors. After discussing the first part, inspection of the abdomen, now we are going to upload the second part, palpation of abdomen. And for percussion and auscultation, we will form a new video in upcoming videos. So, today we are going to demonstrate the palpation of abdomen. So, before palpation of abdomen, you have to remember some things. So, first of all, the position of abdomen. The patient will be lying in supine position and the knee of the patient should be flexed, and you will instruct the patient before to flex the knees. घुटने मोड़ दो भैया, घुटने मोड़ दो. So what is the importance of knee flexion? This will relax the abdominal muscle and you can palpate better. You will ask the patient to deep breathe from the mouth, so it will prevent the unnecessary guarding and it will help you to examine in a well manner. So first of all, the flexion of knee, and you ask the patient to breathe from the mouth. मुंह से सांस लेना है, मुंह खोल के सांस लो, ठीक है? हाँ, आराम आराम से. And after that we are going to start the palpation part. So first of all, the hands of examiner should be well warmed to prevent any voluntary guarding. So knee flex, breathing from mouth, hands should be warm. And how will you start the palpation? The hand of examiner should be parallel to the abdomen. There is angle of 0 between the wrist and the elbow of examiner. The hand placed in that manner. In this manner, like there should be no vertical poking of the abdomen, which will cause discomfort to patient, and you will miss the important finding on palpation. So the hand of the examiner should be parallel to the abdomen of the patient, and there will be, if you have to deep palpation, the force should be applied on the metacarpophalangeal joint, on this joint, not on interphalangeal joint. So the force should be here, not like this. This is the wrong method. For deep palpation, the force should be at the metacarpophalangeal joint, like this, for deep palpation. And you have to conversate with the patient in between to remove his attention during the palpation. So these are the points you should remember before the starting of the palpation part. So in palpation part, the first point will be the temperature of abdomen. So the temperature of abdomen should be taken from this part, dorsal part of the fingers, like this, in all 9 regions. You have to take the temperature. So what is the importance of temperature? There is a localized rise of temperature in inflammation of any organ in any quadrant, and there is a diffuse temperature rise of abdomen in case of peritonitis. So first of all, we are going to take the temperature of abdomen with the back of hand, and we compare it with the any other body part like arm, hair, to differentiate between the temperature of 2 regions. So this is the temperature part. Now second part is the superficial palpation, and second one deep palpation. The superficial palpation should be done here in all the quadrants, and where we going to start the palpation, let's assume the patient has pain in the right iliac fossa. So we are going to palpate the other side or opposite quadrant, and we come to this part in the last to avoid the unnecessary voluntary guarding of the abdomen. So if the patient has pain here in right iliac fossa, we are going to start palpation from the other direction. So first of all, we are going to here, then we are going to the left hypochondrium, then epigastrium, then we can palpate here in umbilical, then hypogastrium, then here, and in the last we are going here in the right iliac fossa, the actual site of pain. So this is the method from where we going to start the palpation. So there are 2 parts in palpation. First is superficial palpation and second is deep palpation. Deep palpation mainly for the organomegaly and will lump. So superficial palpation should be done in pin rolling manner to find any parietal swelling, like this. In a pin rolling movement should be there to palpate the abdomen superficially. And for deep palpation, we use 2-hand technique. One hand will feel the abdominal organ which is or any lump, and other hand is used to put pressure on this hand. So like this, we are going to examine the abdomen by two hand method. One is the below one hand is stable and it is used to feel the deep visceral organ. So this is the technique of deep palpation. So now we are going to demonstrate tenderness, rebound tenderness in this patient and some signs of appendicitis and cholecystitis. So for tenderness, we ask the patient where he had pain. Suppose if he said he had pain in the epigastrium region, we will palpate here. If the patient has pain on our palpation, then the sign will be known as tenderness. So this is the tenderness. Patient has pain on applying the palpation here. And what is the rebound tenderness? So in rebound tenderness means if the rebound tenderness test is positive, there is the inflammation of parietal peritoneum. So what happens in rebound tenderness? We put our hand like this here and we suddenly remove our hand. On removal of hand from this region, the patient has pain. On uplifting our hand. So how this will happen? During the tenderness part, the visceral organ and its visceral peritoneum is inflamed. But in rebound tenderness, the parietal peritoneum also inflamed. So when you going to apply the force on the abdomen, there is a compression of the abdominal muscles. And when you going to uplift this hand, the abdominal muscle and the parietal peritoneum going to come upward. So due to the pull on the parietal peritoneum, the patient has pain on uplifting the hand. So this is the demonstration of tenderness and this is the demonstration of rebound tenderness. So this is the difference between the two. And there is guarding patient, the guarding mainly of two types, voluntary and involuntary. Voluntary guard, patient has voluntary contraction of the abdominal muscle to inhibit the pain. And in the involuntary guarding, there is a diffuse inflammation of the peritoneum and the abdomen appears like board-like rigidity. So the involuntary guarding is also known as board-like rigidity. Rigidity is diffuse and voluntary guarding is localized to some region. So now on palpation, we are going to demonstrate some signs like Murphy signs. So what happens in a cholecystatic patient? There will be inflammation of the gallbladder and its fundus. So during the palpation of fundus part of gallbladder, the patient will catch his breathing during the inspiration, because during the inspiration the gallbladder fundus will hit the finger of examiner. So there will be pain and the patient will catch in between his inspiration. So where is the region for palpation of gallbladder fundus? So here is the midline and this is here is the right costal margin. So we will mark the lateral border of rectus abdominis and on this point below the right costal margin we will place our hand here and at the lateral border of this rectus abdominis muscle. So this is the point. So below the right costal margin and at the lateral border of rectus abdominis we will place our hand like this and we will ask the patient to expire. Bhaiya सांस छोड़ो. And we going to palpate deep. Now we ask the patient to inspire, and if the patient has symptom of cholecystitis, on the inspiration the fundus of gallbladder hits our lateral border of index finger and the patient has catch in between the inspiration. So this is the positive sign and is known as Murphy's sign. And if we are doing the Murphy's sign in the supine position, the method is known as Moynihan's method. So this is the Murphy's sign. So in appendicitis there are 2 or 3 signs on palpation. So in appendicitis, first of all, we have tenderness at the McBurney's point. We have tenderness on the McBurney's point. So we are going to mark the McBurney's point in this patient. So here from the inspection part you get to know. So there is a anterior superior iliac spine at this point and this is the our umbilicus. So we are going to draw a line between the anterior superior iliac spine and the umbilicus. So this is the spino-umbilical line, and at 2/3 from the umbilicus, 2/3 distance, like here, 2/3 from the umbilicus and 1/3 from the anterior superior iliac spine, this point is known as the McBurney's point. So in case of appendicitis patient, the patient had tenderness at this point and rebound tenderness at this point. This point is known as the McBurney's point. So this is the test in case of appendicitis. And what is the positive roving sign in appendicitis? You are going to palpate on the left side like this, and the patient will complain of the pain in the right iliac region. So this sign is known as the roving sign. So these are the signs in cholecystitis and appendicitis. After the tenderness, rebound tenderness, guarding and all these signs, we are going to demonstrate the palpation of some abdominal organ like liver, spleen, kidney and pancreas. So for the palpation of liver, we will going to, the liver is not enlarged in normal condition due to the pathology. The liver will enlarge and comes below the costal margin. So before starting the liver palpation, we are going to start from here in the right iliac fossa to feel the lower border of liver. So for the palpation of liver, the finger of examiner should be placed in right iliac fossa pointing toward the umbilicus or parallel to the costal margin. The fingers of examiner parallel to the costal margin or point toward the umbilicus. So during the expiration, we are going to palpate deep and ask the patient to inspire, because during the inspiration, the liver of the patient comes down with inspiration and hits the lateral border of index finger. So we are going to instruct the patient for deep for expiration. सांस छोड़ो, and we are going to palpate deeply here, and then we feel the liver margin on the inspiration here. So during the repeated this examination, we are going to feel the liver in forward direction. On the expiration, we are going to palpate deeply and we will feel on the inspiration that the lower border of liver hit the index finger lateral border. So in this manner, we are going to feel the lower border of liver, and where we feel the lower border, we are going to put a mark there. Like if we feel the lower border here, we are going to mark this. So where you feel the lower border of liver, you are going to put a mark there. And for the upper border of liver, we are going to percuss from the fourth intercostal space. So we are going to percuss here. If the sound comes resonant, then we have to percuss down. Where the sound comes dull, you will assume the upper border of liver on that point. So we are going to percuss from the above like this, and where you feel the dullness, you will mark that point like this, and by measuring the distance between these 2 points, you are going to calculate the liver span, which will be increased in case of hepatomegaly. So this is the palpation of liver. And for the palpation of spleen, we are going via the same method, but in the left hypochondrium. The finger of the examiner should be going from umbilicus to left hypochondrium like this, because the spleen will enlarge forward and medially, not in this direction, below direction. So this is the question in the NEET PG, why the spleen don't enlarge in vertical direction. Due to the presence of phrenicocholic ligament, the spleen will enlarge in this direction. So for the palpation of spleen, we are going from umbilicus to left hypochondrium by this method, and we are going to feel here on inspiration for the spleen palpation. for the palpation of kidney, the kidneys are retroperitoneal organ. So for the palpation of the kidney, the method is bimanual method. So for the palpation of kidney, we are going to put a hand at the back of the patient here at the renal angle and in the right costal margin for the right kidney. So by placing this hand, we are going to push the kidney upward, and by this hand we are going to palpate the kidney, and on expiration we are going to palpate the kidney deeply, and this hand is used to feel the kidney. So this is the bimanual method for the palpation of kidneys. So for the palpation of pancreas, the patient should be in the right lateral position like this. The patient should be in this direction, and we are going to palpate here in the left hypochondrium and epigastrium region for the palpation of pancreas. In case of pancreatitis, the patient has pain on the deep palpation in the epigastrium and left hypochondrium region. So these are the palpation method for the palpation of major organs, in which the liver is the most important. So after palpating the abdominal organs, I am going to demonstrate some test for the ascitic abdomen. So first test is fluid thrill. So for demonstrating the fluid thrill, the hand of patient should be placed in between the abdomen like this, and one hand of examiner is going to palpate in the left flank, and one hand is used to give the thrill to the fluid from here. From here we going to give the thrill, and we feel the fluid thrill at this hand. This hand placed in the midline to inhibit the subcutaneous vibration of fluid. So this is the demonstration of fluid thrill method. And for the demonstration of shifting dullness is a test which is used to find the any fluid in the abdomen. For shifting dullness, we are going to percuss the patient from the center to periphery. In the center, because due to the gravity, the fluid will accumulate in the peripheries more, and there is less fluid in the center. So there will be resonant note in the center, and if we are going to percuss in the periphery, there will be dull note where the fluid present. So at that point, we mark that point and ask the patient to take the left lateral position, and we are going to wait for 1 minute, and we are again demonstrate the percussion at that part. If the patient has resonant node on that point, so this is the confirmation for ascitic. So for the shifting dullness, we are going to percuss from the middle like this, and we are going to periphery. So if there is resonant note, we are going to percuss more. If we have dull note at some point, let us assume we have dull note at this point, we mark this point by this middle finger and ask the patient to take the lateral position on the opposite side like this, and we will wait for 1 minute for the shifting of fluid to other side. So after 1 minute, if there is resonant note, so this is the confirmation for the fluid shifting. So this is known as shifting dullness. So these are the two methods we have in case of ascitic abdomen. So these are the things, and one thing we have to remember, if there is abdominal distension, and if the distension is due to the bowel obstruction due to the fecal matter, you can feel the hard feel of fecal matter in the palpation part, or you can see the pitting on pressure on abdomen. So pitting on pressure and hard and alternate soft part is indicative of fecal matter which cause the abdominal distension. So these are the point in palpation. So for the completion of palpation, we also look for the supraclavicular node palpation here in the left supraclavicular region, because in case of any abdominal carcinoma, there will be mets which will deposit in the supraclavicular lymph node region, and so this is the very important to palpate the any suprascapular lymph node enlargement. And other importance of abdominal palpation, that we have to remember we are going to palpate the spine of patient for any spinal tenderness in like this manner. So what is the importance of spine examination? We are going to rule out the any port spine which will be the cause of abdominal TB. So before the completion of palpation, the rectal examination is very important part of the abdominal palpation examination part. So the rectal examination is very important in case of abdominal palpation. So with abdominal palpation, the supraclavicular lymph node, spine palpation and the rectal examination is very important. For the rectal examination, we will going to upload a other video. So for the palpation, we are going to complete our video at this point. Thanks for watching. For other content, please subscribe our channel and share with your friends. Thank you.